Now we're going to talk about maternity units. Babies, one of my favourite topics, and what we're going to see is there are a diverse range of places that people can have their babies. There's lots of different models of cares, and there are many, many different people from lots of different cultures bringing life into the world. That being said, not all pregnancies or birth go to plan. Some pregnancies are lost along the way, and some children are born early and they have a lot of problems, and some unfortunately do die at birth. So there need to be services that can care for the children that need extra help. So let's talk statistics. In 2011, the Australian Bureau of Statistics estimated there were 300,000 babies born in Australia that year. Approximately 155,000 of those were boys and 147,000 of those were girls. The median age of the mother was 30 years and the median age of the father was 33 years. In Australia, there are 300,000 babies born each year, and there are a wide range of options that the mother can bring the baby into the world. In the private setting, the obstetrics and gynaecologists will manage all the prenatal care and deliver the baby. In the public hospital clinic and the public hospital midwife clinic, this is where the midwives look after the mother all the way through the pregnancy and then deliver the baby. There are birthing centres, and this is where there's a team of midwives that again cover all facets of the pregnancy to delivery. In the rural sector, there are shared models, and this means that the general practitioner and the midwives tend to share the care of the mother in that time. And there are also planned home visits, and this is where the midwife will work with the mother and they will deliver the baby in the mother's home. In the hospital setting, there are a range of units where a pregnant woman can go. So the antenatal ward is for the mother who's about to have the baby. Then there are the birthing units and the maternity wards that care for the mother and the baby after the baby's born. We're going to go through each one of those now. The antenatal ward literally means before the baby's born, and there are many maternal complications that can result. So this might mean high blood pressure for the mother, and then the baby has reduced blood flow. There might be placenta previa, which is where the placenta actually lies over the opening which the baby will come out of. And what that means is there can be massive blood loss. So the mother will need to have an urgent caesarean as soon as she goes into labour. There might be other things such as preeclampsia. This is a very common condition where the vessels start to constrict in the mother, and they also can get liver problems where blood then starts to thin. The mother can potentially start to have seizures and die, as well as the baby getting very damaged during this process. So all these potential problems can exist in the antenatal ward, and it's the role of those midwives to look after these women to ensure these complications don't lead to any difficulty to the mother or the baby. So all these complications that potentially happen to the mother are managed in the antenatal ward. So the midwife's role is to watch for any abnormalities and make sure that the mother and the baby do well. Now we're going to talk about the birthing unit. The birthing unit is where labouring mothers go to deliver their babies. It's manned by doctors as well as midwives who will look after the mother, manage pain and manage the changes to the body as the woman is labouring and delivering the baby. This is an amazing place to work, and they see a lot of very fantastic labours and a lot of beautiful deliveries, but there are times where deliveries do go wrong. So the midwife is there to counsel and help the family through this very difficult time. Next, we're going to talk about the special care nursery. This is where babies who've had complications during their birth are closely monitored. Some babies can become very fatigued during the birthing process. Others might inhale meconium, which is like a waste product which goes into their lung, and this can cause severe breathing difficulties. Some mothers may be taking illicit drugs, and the babies might in fact be addicted to those drugs. And so during this period of time, they need to be closely monitored to make sure that everything's okay. Often babies of diabetic mothers will have a very low blood sugar level on arrival, so these babies just might be in a little bit of monitoring. They'll have an IV line put in and just given a little bit of glucose just to make sure they're okay during that period. If the child is too unwell, they will be placed in the neonatal intensive care. The maternity units is where the mother and babies go after the birth. The children undergo a range of tests, some of which are hearing, and the mothers who have had caesarean sections and maybe epidurals are monitored until all the feeling returns and their blood pressure and all those hemodynamic changes go back to normal. Breastfeeding is taught to the mother, and there are appointments made for the mother so that they can have further ongoing postnatal checks. So postnatal checkups are very important after the delivery and after the mother and the baby have been discharged. The mother is monitored for postnatal depression and the baby is monitored to make sure that it's meeting all its milestones.